I see a lot of Black women in my office, particularly because we specialize in treating skin of color. And one of the most common reasons why Black women come into the office is because they deal with facial hair. And the concern is always whether or not we have lasers that can treat people who have darker skin tones, if it's safe. And so I want to talk a little bit about laser hair removal on the face in people who are Black or have darker skin tones, and what the process is like. And I'll show some videos of how I do it and some before and afters as well, just so you get a comprehensive idea of the process of doing laser hair removal for people who have darker skin tone. All right, so stay tuned. Hi everybody, my name is Dr. D. I am a cosmetic physician in Northern Virginia, and my practice, Delight Medical and Aesthetics, focuses on cosmetic treatments for people of color. Alright, so you've decided to come in for laser hair removal on your face, and you want to know what the process is like. But first, before we even get to doing laser hair removal, there are a few things you have to understand about facial hair in women. For the most part, facial hair in women is not normal, okay? And there's a caveat to that because there are certain groups in the world where facial hair is very normal in women. But in general, thick facial hair on the face is not normal. And the reason why it's not normal is because there's usually a hormonal component or a hormonal imbalance in the body that's causing you to have thick hair on your face. All right, so naturally we have thin vellus hair on our faces. Now, in the presence of a hormonal imbalance or an elevation of the wrong hormone, we're then going to have our hair go from vellus or thin to coarse or terminal hair. All right, and so it's important to keep that in mind because later on that's going to determine a lot of different things in terms of the difficulty that comes with trying to manage the hair on the face. So how do lasers work? Lasers are this big machine that emit a wavelength of light. In the case of darker skin types, we use a 1064 nanometers, and this wavelength of light is going to target the melanin in the hair follicle, and it's going to destroy the hair follicle. That's the goal of laser. Now, it's important to understand that different lasers have different wavelengths, and so for patients who have darker skin, we choose to use the 1064 nanometer wavelength because it's a longer wavelength, and also because of that, it's going to penetrate deeper into the skin and it's going to target the melanin in the hair follicle, not the melanin on the surface of the skin. And if you see patients get burns, usually it's because the laser might have a hard time distinguishing between the melanin on the skin and the melanin underneath the skin. All right, so that's when things get kind of dicey. Now, your hair grows in different growth cycles, and you have multiple phases of hair growth. And when you come in to do laser hair removal treatments, we're not going to be able to get all of the hair during that one session. So as a result, you're going to have multiple sessions, usually between 4 to 6 weeks on the face, for example, or 6 to 8 weeks on the body. With each treatment, we're able to eliminate about 10 to 15% of that hair permanently. Now, overall, laser hair removal is not a permanent treatment. We're able to remove 80+% of the hair, and some percentage of that hair will stay dormant and it will come up at random times, such as pregnancy, such as times when you go through periods of intense stress, COVID being one of them. And so you're gonna need to have that maintenance treatment where you're coming back every 3 months or 6 months after you've done your full session of treatments to then get rid of the leftover dormant hair that's now coming up. Now, if you're going to do laser hair removal treatments on your face, it's important to make sure that you're not using any retinols about a week prior. It's also important to let your practitioner know if you're on any medications, such as antibiotics, because there's some meds, such as doxycycline, for example, that are photosensitizing medications. And so if you're on that type of medication and you get laser, there's a very good chance that you might develop a complication called post-inflammatory hyperpigmentation. So always disclose the medications that you're on. If you're going to a place that doesn't check your medications, you might want to find somebody that does, because medications do play a huge role in the potential complications that can come up from this particular treatment. So when you come in for your treatment, you're gonna shave your face. Usually I recommend that you shave your face the day of the treatment. And then in my office, we use a laser called Splendor X. It's an Alexandrite and a YAG laser. So we would use the YAG laser on patients with darker skin. And we also have a Zimmer, which is a coolant. So when we're doing the treatment, there's cool air going on your skin. And the cool air helps because it keeps the surface of the skin cool, while the heat from the laser can penetrate deep into the skin and target the hair follicle. So you want something that combines the two, because with darker skin, we are very sensitive. And if you just put direct heat on the face without some sort of protection, that is going to potentially lead to hyperpigmentation, which is something that we don't want, all right? Now, most of the time when women are coming in with facial hair, it's not just that they have facial hair, it's that the facial hair is thick and coarse, and it tends to cause ingrown hairs or pseudofolliculitis, and also that can then lead to scarring, and sometimes it can lead to hyperpigmentation. So facial hair is not the only thing that we have to worry about. We have to worry about so many different things as well that are complications from the facial hair. A lot of times patients will try to treat the complications without treating the hair itself. And I always say we have to get rid of the hair first before we can fix your skin or fix the scarring that's going on your face. Here you can see me doing a treatment on a patient. In my office, it's a very fast procedure. I can do your full face within 2 minutes. And then afterwards, if you have a reaction, which some people do, which is called perifollicular edema, we would use a steroid cream or aloe vera gel to help calm the area down. And I usually would see my patients back every 4 weeks. So why is facial hair such a difficult thing to treat? Like I said earlier, facial hair is hormonally driven, and usually if you have facial hair, you either have hirsutism or you have PCOS. I have a video that I did before on this topic, so I'll link that in the description below. But if you have hirsutism, then usually you have elevations in your testosterone that is causing you to have facial hair. And this elevation could be genetic in nature, or it could be due to insulin resistance. When you have insulin resistance, that tends to cause hyperandrogenism, which then will trigger an increase in testosterone. So that's one side of it. The other side is when people have PCOS. Now, in the case of PCOS, they have testosterone that's coming from the ovaries, right? They have cysts in their ovaries that are producing testosterone, which is an exogenous form of testosterone, and that is triggering facial hair in these patients. However, for some patients, they have both testosterone and insulin resistance, and so when you combine the two, they have an even heightened form of facial hair. Laser hair removal only helps with the end result of the problem. If we treat the hair and we don't address the cause of the hair, we're fighting a losing battle. Usually on social media, I see people say laser hair removal doesn't work, and I tell them it does work. It's just you only treated the symptom and not the problem. And if the problem is insulin resistance, then you need to work on making sure that you're not eating processed foods. You need to make sure you're not eating sugary foods. You need to make sure that you're watching your diet and you're exercising. And if you have weight to lose, then you need to lose the weight. That's what you need to do to prevent the hair from coming in thick. And people really don't want to hear this, but this is the truth, okay? If you have PCOS, again, diet and exercise will be a very important part of managing it. But also, you know, you can talk to your OBGYN to come up with treatment plans to help decrease your testosterone levels in your body. But as long as your testosterone levels are high, we're gonna have a hard time getting rid of the hair completely. So normally with my patients who have hirsutism, it takes about 6 to 8 treatments to get them to a place where they feel comfortable with the hair. So the hair is thin and it's not coming back as fast. Now, if they're not doing what they need to do, which is working on their diet and making sure they're decreasing processed foods and carbohydrates, the hair could potentially start to come back thick again, because the trigger for the hair to become thick is the testosterone. And if you don't work on it on this side, you're not gonna get results on this side. And so that's usually the most common reason why people fail with laser hair removal on the face. One last thing to keep in mind with laser hair removal on the face, some people, very few, will get a complication called paradoxical hypertrichosis, where instead of having hair removal, the laser will actually trigger the hair to grow a lot more than usual. I've seen this a lot more, and is explained in the literature in South Asian and Middle Eastern people, but I've seen it in a Black patient as well, because most of my patients are either Black or have darker skin. So it's not something that's uncommon, and the way to treat it is just to keep doing laser hair removal treatment until the hair eventually goes away. In these before and after pictures, you're going to see improvement in hyperpigmentation and the texture of the skin as well. Patients also get reduction in the scarring of their skin. Laser really works. Laser hair removal can be life-changing, and people who have Black skin or darker skin can get laser hair removal. You just have to make sure that an ND YAG laser, 1064 ND YAG laser is used. Make sure whoever you see has a lot of experience treating Black and darker skin tones. And if you're in the DC metro area, stop by Delight Medical and Aesthetics and we will take care of you. Bye.